right, welcome to day 3. Give yourself the glasses because I know you're focused, you're dialed in. Today I'm about to make your lower back feel as good as can be. Today's exercise practice is all about helping you prevent and manage low back pain. We're going to begin laying down on our backs again for day 3. Go with the pillow again if you'd like. I'm going to go without the pillow just like I did yesterday. So we'll toss that out of the way. We're going to keep the knees bent to start. Shoulders and head back fully and comfortably supported on your bed. Just remind yourself again to just work on posture so the neck is not jammed upward, lengthening through the spine. And from here, we're going to get right into a single knee to chest stretch. So having both knees bent neutralizes the lower back. It's usually more comfortable to start with, especially as we're getting moving initially with this program. So we're going to start with the right leg. Bring that knee toward the chest or toward that right shoulder. Use the hands to either grab on the upper part of the shin or behind the knee if it's more comfortable, or if your knee is a little bit stiff. I'm going to go above the shin here, and my arms are going to gently bend at the elbows to pull that knee in toward the shoulder to feel a nice stretch through my hip, maybe my butt, lower back area. Everybody is going to feel this differently. Work on breathing from that position. And subtly let it back down. And let's repeat that again. Right knee up. Nice breath in. Feel the belly kind of massage the thigh, or vice versa, the thigh massaging the belly on that inhale. Exhale out. Let the belly recoil in. It helps to tilt that pelvis back to increase the stretch. And then slowly release. And now let's go right into a hamstring or sciatic nerve stretch position. We're going to grab behind the right leg, kind of at the crease of the knee, and hold the hip at a 90-degree angle. So the kneecap faces straight up to the ceiling, elbows relaxed, shoulders relaxed. And just supporting the leg in that position, slowly extend the knee to feel a nice stretch in the back of the leg. Pause a few seconds and we're going to slowly bring it down and then right back up. It's kind of a pumping mechanism or a pumping movement to get the muscle and the nervous tissue to just start to move here today. Let's go again. If you feel comfortable at the top, you can pull the ankle and foot towards you to increase the stretch in your calf. For some, that may be a bit strong. That's nice and tight on me. And then release the ankle and bend the knee. Let's do one more. Straighten the knee. Squeeze the thigh to feel that stretch in the opposite muscle in the hamstring area. And then if you feel good, pull that ankle and foot towards you to increase the stretch. And relax. Very nice. Now we're going to switch sides. So bring the left knee up towards the left shoulder. Grab the knee, whatever position is comfortable. And then elbows just relaxed at your side. Gently pulling the knee towards your chest, aiming towards the tip of the left shoulder. Nice breath in and relax. And then gently bring the knee back down, Let's go one more time, knee towards the shoulder. Use the hands to gently assist the movement. And let's release the knee back down, foot to the bed. Let's go right into interlocking the fingers to grab behind the left thigh at the crease of the knee, hip at a 90-degree angle, and from here again, straighten that left knee to where you feel tolerable and comfortable. A good stretch is the goal with this. A lot of times with back pain, we become fearful to move. It can be a pretty debilitating condition. And so we want to encourage movement. All the research out there shows, let's go ahead and straighten the knee again, that the more we gently restore normal, we gently start to move, the better your outcome will be. And if you don't have back pain, let's keep it that way. So this is a great practice to maintain. Go ahead and relax the knee back down. 2 more times as we create this pumping mechanism to straighten the knee. And now try to bring the foot and ankle toward you if tolerable. If not, just keep it relaxed. And then pump the ankle away to relax, And bend the knee down one more time. Straighten the knee, tighten the left thigh. Foot and ankle towards you at the top to increase the stretch and release. And now we're going to keep the feet and the knees together. Arms at your side. If you want to take them out away a little bit, that's fine. But from here, we're going to keep the upper body relaxed, and we're going to do a lower trunk rotation, but from a neutral spine posture today. So yesterday we elevated the legs up. You can always do that, but today we're going to keep the feet supported and gently let both knees roll toward the right side. Keep that left shoulder flat. This isolates a little bit more towards your lower back. Your pelvis is rotating into that lumbar spine and then translating upward. Bring the knees back to center, and let's let them go the other way toward the left side. Keep the right shoulder down. Nice stretch. Let the weight of the legs just kind of draw that pelvis forward. Bring the knees back to center. And then knees to the right one more time. The left butt cheek rolls off the bed to create that nice trunk rotation. And knees back to center. Last time, knees to the left. The right hip rolls off the bed. Increase the stretch. Take a breath. And on the exhale, knees back to center. Now we're going to do a double knee to chest stretch. So this really gets a nice lower back stretch to elongate those paraspinal muscles. So we're going to bring both knees up toward the chest. We can either draw the belly down and in and actively create that movement, or you can use your hands to assist. If you grab the side of your legs and gently want to assist to get there, that's fine. If you have a towel, you could wrap a towel around and kind of help pull if you're stiff or it's too strenuous to do that. But let's go both knees toward the chest. If we can, we're going to grab around the knees and assist that movement in. As you're here, keep the chin tucked into the front of the neck to lengthen the spine. And then think of the tailbone kind of rolling away from the bed to flatten your lower back. Nice stretch. Ease back down. Let's do one more time. Both knees up. If you're loosening up and you want to kind of hug the knees in and really wrap the arms around to give that pull, that's completely fine. Nice stretch through the lower back. And breathing through that process. And then slowly bring the feet back down. Nice and supported. From here, widen the feet to about shoulder width apart. Knees the same way. Don't let those knees collapse into touch. From here, we're going to keep the arms down, palms down on the bed. Shoulders relaxed, gently squeezed into the bed. Push the feet down, squeeze your butt, and come into a bridge pose. Nice extension through the hips. That's the primary motion we're going to start with to take a little pressure off your lower back and come back down. Think of hinging the hips down. If you feel comfortable now, we can start to envision and create movement through the spine. So push the feet down, extend the hips, and then you can start to press the belly up to shift weight more onto the shoulders, arching your lower back slightly, and coming back down. Let's do one more time. Pushing the feet down into the bed, squeeze of the butt, engage upward, head and shoulders relaxed, and back down. Very nice. Now from here, we're going to roll onto our side, just like we did before, because it eases that pressure off of our lower back versus thrusting right on up. So I'm going to roll to my left side and use that elbow to kind of help come to a seated posture. I'm going to bring my pillow back up onto the bed. From here now, we're going to transition into some extension. The bridge is a nice kind of gateway into that, but we're going to come into a belly posture or position, but using the height of the bed or the angle of the bed to keep one leg down and one leg up. So I'll show you this to start. You can face either way. I'm going to bring my right leg onto the bed, left foot stays on the floor, and I'm going to come into a prone or a belly position. Arms just comfortable here. So you can rest the head down, forehead on the hands, and just kind of hang here if you like. The height of the bed will have an influence, obviously, on this leg position. If it's a lower bed, your hip will be more flexed. That's fine, or you can shift your leg behind you a little bit further. But if we can keep it up about a 90-degree angle, it's going to neutralize that side of our spine so we can bias more extension from the right side of our back. And from here, we're going to come up into a prone on elbows position. So we're going to tuck the elbows in towards our sides and then gently push up into this nice extended posture. Keep the head just neutral and moving with the body. We're not cranking the head or neck way up at this point in time. Should feel a good stretch in your lower back. You may feel some tightness in the front of the hip and the groin area, which gets the hip flexor to stretch out. And then ease back down. Let's go one more time, pushing the forearms and palms down to lift the chest up and away. Keep the pelvis in contact with the bed. And back down. Last time, if you feel good here, slide the hands back toward the shoulders and come into what we call a press up position. In yoga, this is your upward facing dog, but we're biasing a single side here. If you can get the elbows straight, great. Try to keep the pelvis down. If it lifts a little bit, that's fine, but don't force that. Just easy and gentle. If you can't get here, stick to the forearms or just stay on your belly and stay there for a prolonged amount of time and then ease back down. From here now, we're going to use the hands and kind of press up onto the knee, the right knee, and the palms of the hands. Gently shift the right leg off the bed. We're going to turn and face the bed here. And from this position, we're going to come down into a forward fold. So let your hands rest on the front of your legs, feet shoulder width apart, and gently let yourself bend forward. Think of leading with the upper back and shoulders. Then the lower back starts to move. And you can bring the hands to the bed when they're there. And just let that support if it feels too strenuous to go all the way down towards your ankles or feet. And just take a nice comfortable forward fold or a flexion posture. And then to come back up, think of pushing the feet into the floor. You can bend the knees slightly if you need to, but squeeze the butt, draw through the lower back, bring the shoulders and upper back over the hips to upright posture. Let's do that one more time. If you feel good and you want to go all the way down without using the bed, you can always step back or adjust that posture so you don't hit your head on your mattress. Or you can rest your head on your mattress. Sometimes that just feels nice as well, just to kind of relax and feel a stretch in the hamstrings and the lower back. We already warmed these muscles up to start. And then come all the way back up to standing. And now let's switch sides. So I'm going to go left leg up on the bed, right foot to the floor, into that kind of single-sided biased prone or belly position. And just kind of laying here to start, get comfortable, adjust the right foot on the floor as you need to. I'm going to bring my forearms onto the bed and gently push my chest up and away from that mattress to create a nice extension. My left leg presses gently down into the bed. Helps engage my lower back muscles and keep some stability and ease back down. Let's go again. Nice breath in as we lift. Pressing the forearms into the bed. Exhale to release. Last time, if you feel good, slide the hands back. Come into a press-up position. Nice breath in. Keep the front of the pelvis down on the bed. Do what you can. If you can't get here, again, we'll build towards this. Stick to your forearms for now. Exhale and release. And then gently press up, hinge from that left hip, come onto the knee, and just kind of walk your leg off the bed. Let's finish with 2 more forward folds for today. And we're going to add some shoulder movement to really get nice upright position. Let's fold down first. Use the bed here for support to start after we went into that full extension. Just a nice way to ease into the opposite movement pattern. And coming back up. Reach overhead. Palms facing each other. Fingers spread wide, shoulders relaxed. And then arms down toward the chest. Drop forward again. Use the bed if you need. If not, slide all the way down. And then drawing back up, pushing the heels into the floor, squeeze the butt, pull through the lower back, get the tailbone underneath your body, shoulders back over the hips, and then reaching up to the ceiling, palms facing each other, pull the thumbs back behind the body, and relax the shoulders down to get a nice stretch. And bring the hands toward the chest, palms together. Nice breath in, and exhale. You did it. You completed day 3. Keep this program in mind. It's really important to help us prevent and manage lower back pain, a very chronic problem that a lot of people suffer with. So use this frequently, use it often, come back to it, and I'll see you tomorrow.